Hi, I'm Dr. James Biddle. Welcome back to Future Doc, the TV show. We're covering a series of medical topics important to you and your health, and we're doing that from a point of view of integrative medicine. Integrative medicine is combining the best of both conventional medicine and alternative medicine. And we're going to pull those concepts together and show how we can tackle different health topics and help you stay healthier longer. In talking about diabetes, we're going to introduce basically three types of diabetes. The classic type of diabetes is type 1 diabetes. These are the people who have partial destruction of their pancreas, and therefore they don't make enough of the hormone insulin. Insulin is the hormone that you release from your pancreas to control your blood sugars. Insulin actually goes to your cells and tells your cells to take up sugar into the cells, and that's how they control your blood sugar. That's how insulin controls your blood sugar. Type 2 diabetes is just the opposite of type 1. In type 1 diabetes, you don't have enough insulin to tell your cells to take up the sugar. In type 2 diabetes, you start off actually with too much insulin. And we'll go into more depth about how you get too much insulin. But type 2 diabetics are classically overweight and have been for a while. And they create excess insulin, then they get insulin resistant. And after years of being insulin resistant, then their sugar finally goes up and they're classified as a diabetic. We're seeing a lot more of the third type of diabetes called an incomplete type 1 diabetes. These are adults with partial pancreatic destruction. So the type 1 diabetes is often called juvenile diabetes because little kids get it or teenagers get it. But we're seeing more and more of this in adults also, where adults get pancreatic destruction, but sometimes it's not a complete destruction. They still have 10% of their pancreatic function left. So they look like a type 1 diabetic, but not completely. And the first clue to those people is they're not overweight. They come in and they're actually underweight, they're too thin, and they're being treated as a regular insulin-resistant type 2 diabetic, and that treatment doesn't quite work for them. So what is diabetes? It's when your blood sugar is too high. Your blood sugar should almost always stay less than 100. Even after eating a big meal, it should be less than 120. And if your blood sugar is going high, there's a reason. It's either too much insulin or you're resistant to it. It's not enough insulin or you're resistant to insulin. You have too much insulin to begin with, but your cells aren't hearing the message anymore. So that's the basic introduction to what diabetes is. What's our goal in diabetes? Well, our goal is to control those sugar levels. Why? Why do you have to control sugar levels? What happens to your body if your blood sugar goes high? What's wrong with that? Well, if they go very high, then I've already said you pee off a lot of your energy and you lose weight, the wrong type of weight. The other thing that happens if they're too high is when you're peeing off all that sugar, you also pee off all your water and you get dehydrated. So people who are having that problem actually end up in the hospital with dehydration and severely elevated blood sugar levels. But the more common complications are because the sugar hooks onto your proteins throughout your body. We have proteins on all of our cell membranes and inside our cells, and when the sugar hooks onto the proteins, it makes caramel. You actually caramelize your protein receptors and gum them up, and then they no longer work. How do we track this for patients? Well, we want to measure their blood sugar levels, and obviously you can just measure the sugar level, usually in the fasting state, but you can also challenge people with food and look at the after eating, or called the postprandial state. And all doctors do this. All doctors also measure the average blood sugar level. This is a test called the hemoglobin A1C. This works because your red blood cells last about 3 months before they're recycled through your spleen. Your bone marrows make your red blood cells. They float around for about 3 months, and then your spleen says, oh, that's an old one. We're going to take it out of circulation now and break it down and recycle its components. We can measure how much sugar is stuck onto your red blood cells. That tells us what your average blood sugar is over the last 3 months. There's no lying about this. You can tell me you haven't been eating cookies, but I can see just how many cookies you've been eating by checking your hemoglobin A1C. The normal value for this is less than 6. For really perfectly healthy people, you want this less than 5.5. The other things that we can measure that usually are not measured is your actual insulin levels. So when you eat sugar, your body responds by releasing the insulin to bring down your blood sugar levels so you're not going to caramelize your proteins. And by the way, where does that sugar go? Well, it goes into the cells, but what do the cells do with that sugar? Well, you can either burn that sugar for energy right now, You can store just a little bit of it for short-term energy, or you store it as fat. Insulin is a fat storage hormone. Insulin says, store fat, store fat, store fat. So as long as you're releasing a bunch of insulin, you're going to be in a fat storage mode, and you'll never be able to lose weight because you'll just be storing fat. So the way that insulin brings your blood sugar down is to bring your fat levels up, unless you're exercising. And one of the fats that it tells to upregulate is cholesterol. High cholesterol, the majority of the time, is really due to an insulin resistance problem. If we can reverse the insulin resistance, then people can get off of, I would say, 80 to 90% of their cholesterol medications. There are 5 to 10% of the population that have genetic problems that really need those cholesterol medications, but a large majority of them can get off of those medications if they change their diet and lifestyle in such a way that they can control their cholesterol. Now, one of the problems with using insulin, and why I wrote Full Speed Ahead, Damn Their Torpedoes, is that unfortunately a lot of patients are taught that the only important part is to control the blood sugar level, and you should just use as much insulin as you need to do that. So the standard diabetic diet taught by the American Diabetic Association has a lot of carbohydrates in it. That raises people's blood sugar levels. They inject more and more insulin in order to bring that blood sugar down, and then the people end up storing more and more fat. So pretty soon they're not only a type 1 diabetic, but now they're also a type 2 diabetic. They also have insulin resistance. The human body who is eating appropriately and exercising should only need about 30 units of insulin a day. Maybe a little bit more if you're big, a little bit less if you're small. If you're a type 1 diabetic and you're injecting 50, 60, 80 units of insulin a day, all that extra insulin is really just feeding insulin resistance. And if you're using all that insulin to control the blood sugar level, you're going to end up with insulin resistance. And even if you keep your blood sugar normal, you're still going to get diseases because that insulin resistance can be driving your cholesterol up and causing other problems in the body. There's also medications that conventional medicine uses. Some of these I think are very good. Some of them are not so good, and some of them are brand new, and really we got to see how they turn out. The basic classes, the ones I don't like are called the class of sulfonylurea. Sulfonylureas were the first class of diabetic medications that were brought out over 50 years ago. And what they do is they whip the pancreas into making and releasing more insulin. Obviously, these are only used in type 2 diabetics, the adult onset diabetes. But the sulfonylureas end up making people gain weight because they make you release more insulin and you store more fat. They also end up putting you to end-stage diabetes and wear out your pancreas faster because it's like riding a horse around the racetrack, and after you win the race, you just keep on going, whip that horse until it drops dead. So the sulfonylureas, unfortunately, are whipping a tired horse. They're whipping a pancreas that's already not keeping up and telling it to make more insulin. The best medications are those that actually help reverse the insulin resistance. So my favorite of this is metformin. It is now available generic, so the cost has come down. And metformin has been shown to help patients lose weight and also control the blood sugar. So that's a very good combination. And that's the number one thing to try. Metformin can have some bad side effects. Some people get loose stools from it and bloating. And so you have to kind of work up gradually. And if that's a problem, you can use a time-release metformin, which is not generic yet. And then the glitazones. There's rosiglitazone and pioglitazone. These have trade names, but on a TV show like this, I'm not supposed to say the trade names. So these are actually kind of a mixed bag. There was news out this last year that these medications might be increasing the risk of heart disease, which is kind of a bad trade-off for controlling diabetes. But yet they also are very good at controlling the blood sugars, and they tend not to cause too much weight gain like the sulfonylureas. So they're not as good as metformin, but they're better than the sulfonylureas for our goals of diabetic control. And then there's newer drugs such as incretins. Incretin is actually a hormone that's released from your stomach after you eat to make you feel full. So incretins actually improve the way the insulin reacts in the body. It decreases appetite, and incretins seem to be very promising. It isn't a naturally occurring compound that's in our bodies, so that's a good thing to me. I always think that we'll do better if we amp up some of those rather than taking a completely alien compound that's just poisoning an enzyme in us. But we really, until millions of people take them, these just came out this year, so until millions of people use them for a couple of years, we won't really know how well incretins work because it's really in the post-marketing use of it that we see the bad side effects of these medications.